All right, Southwest Florida, we're so thrilled to bring to you the one and only, the CEO of Hope Healthcare, Samira Beckwith, and President. Welcome to Lead Pitch Live again.
Thank you, lady. Always a pleasure to be here.
Always great to have you. Let's bump you in as a tradition. And you're always so well dressed. Do you order your stuff, or you go into a store, or you got a stylist?
You know what? Sometimes I go to stores, sometimes I'm on the computer.
Okay.
Sometimes I go to Hope Chest, our resale store,
Really?
where you can get great items at a great price and help Hope at the same time.
Well, that's a segue right into those things. Hope Chest, you call it?
Yes.
What is that? Tell me about that.
That is our resale store.
That people may see around in the community.
Exactly. We have 3 of them. One on Daniels near 6 Mile Cypress. We have one in the Cape, and we have one in Bonita Springs. So easy to find, and if you can't find it, call our main number and we'll tell you where it is.
What does it entail in those stores?
Oh, we have furniture, we have clothing, we have knickknacks, we have home goods, and people donate to us because they want to support the organization. And sometimes we'll get an entire house full of items. And so we have volunteers who work there. Also an opportunity for people to volunteer.
You got a chance to, there were 3 other entities that you named. You named the Hope Health Chest, and go ahead and finish up.
Well, Hope Chest, and that we have 3 of those.
You got a chance to hear Beatrice Jaquette, who was not scripted, just come on this show, and she talked about the outstanding services that her relatives received when they were here at Hope Hospice. How did that make you feel to hear that testimony?
Well, it was so wonderful to have her share her experience, because people are oftentimes afraid of Hope Hospice because they don't really understand all that we can do, and it's a very difficult time for them. So it warmed my heart, it made me smile, and it also brought tears to my eyes, because that's what we're here to do.
Right.
Is to help make that journey less lonely and to make it less difficult for people.
And everybody will make that journey. Hospice, Hope Hospice has been in the community for many years. Give us a little history of it.
Well, we've been here for over 40 years, caring for people when they have a serious illness that may result in less than a year to live. Some people are with us for days, some people are with us for years. It just depends on their individual journey. And we have our 4 Hope Care Centers. We're here today at our Health Park Care Center.
Okay.
We have one in the Cape, we have one in Bonita Springs, and we have one in Lehigh. So we can care for people at our care centers. However, primarily we care for people in their own homes. We can also care for them in an assisted living facility, nursing facility, wherever they call home.
You know, when I first met you, it was real simple. I could just say Hope Hospice.
Right.
Now, as things have evolved, I hear the word Hope Health Care, all these different Hope this and Hope that. Can you summarize the basic thing that people need to know about Hope Hospice, Hope Health Care, I guess?
Well, first let me say we have known each other a long time, and it's just been so much fun to see you do all that you're doing in the community. So I want to say thank you for that.
Appreciate it.
And we have our umbrella name, Hope Healthcare, because we started as Hope Hospice.
Right.
And then we added additional programs, which is why we added the umbrella name. Hope Hospice is available for people at the time when they have a very serious illness, and it looks like they're nearing the final chapter of their life. And that's why we have these different services available for them. We have an entire team, a nurse, social worker, physician, chaplain, volunteers, therapies that can come to the home. We can provide medical equipment, a bed, over-the-bed table, and really important, we provide medicine that people need so that we can focus on their comfort. We provide expert care, again, at this most difficult time.
I've had shows and we've talked about it. You also do estate planning or wills and all these other things. So people, I want you to expound on, there are a lot of other services that come in their circumstances that people need to know that they can take advantage of way before in the life situation began?
Yes, we want people to know that there's some advanced planning that they can do.
Okay.
And we have seminars, we have different opportunities to share with them the fact that they can fill out different forms, have conversations with their family members. It's very interestingly that people will plan for their vacation, they'll plan for lots of different activities. They don't plan for their final chapter of life. And we want people to know that it's not only good to talk about it, it's important because it's a gift that they can give their family, letting them know what their wishes are.
Over 65 million people are caring for loved ones now. Talk about that.
Well, we care for the person who has the illness, who's in the final chapter of life. However, there are so many people who are serving as caregivers for their family, their friends, and that's a really large group of people. So at Hope, we take care of the person with the illness, the patient. We also take care of the caregiver. It's a lot of work to be a caregiver. And sometimes people don't know how to do it. You know, for example, they don't know how to help move their loved one from the bed to a chair. So they hurt themselves. And we want people to know that we're here to help with being a caregiver. I'm going to give you an example. When you're on the plane, the flight attendant's making that announcement, and a lot of people don't listen, but you should listen, because what do they always say about the oxygen mask? They say it's going to drop down, put it on yourself first, so that you can take care of your child or your family member that's with you that needs help. Well, we want the caregiver to also take care of themselves.
Right.
So we have different support groups for the caregivers to be sure that they're also taking care of themselves so they can take care of their loved one.
There are people now who may not be sure that they are ready for Hope care, hospice care.
Yeah.
What advice would you give them right now when they're considering hospice care?
I would ask them to give us the opportunity to explain what Hope Hospice really provides and what we really do. There's a lot of misconception, a lot of myth, a lot of unknown, because it's a scary topic. And people think that it's only for the last week of life, the last month of life. And as I mentioned, we have people who have been on service for a year, for 2 years. And so I say, please at least explore the option for yourself as a person with the illness, but also for your family members, because people fear being a burden on their family. Let us help everyone to make the days less lonely and less of a burden on anyone.
And we have your contact information appeared on the screen throughout the interview.
Right.
When they reach out, go to the website and do all those types of things, will they get the chance to talk to a human being early on?
Yes, we answer the phone. We have people on the phone. And when somebody's actually on hospice care, we have a nurse that answers the phone 24/7. So if something happens at night, you know how scary it is when somebody has a symptom that changes during the night. And what do? You call us. We have staff that can come out any time of the day or night. And then also, if someone calls us and they're not ready for hospice, eligible yet, then we have other programs. We have palliative care. We have PACE, Program for All-Inclusive Care for the Elderly. We have additional programs in Hendry and Glades for activities. And so we might be able to refer to one of our other programs at Hope. If not, we'll make a suggestion for another program in the community that can help them.
Outstanding. You mentioned PACE. Hope PACE is very innovative. You are very excited about what happens with Hope PACE. Will you expound on that, please?
Yes, it's our program for all-inclusive care for the elderly. It's really like a club.
Okay.
We have an activity center.
Really?
That people can come to if they're in the program, where we have, sometimes bingo, different activities. We have sessions on reading the paper, listening to the news. We have sometimes we have manicure day, pedicure day. And we also have therapy, physical therapy, occupational therapy, and we have a physician or a nurse practitioner on site that can actually look at the person and maybe prevent a problem by catching an infection early. I don't know if you've seen our PACE mobiles. I like to call it
but that was going to be one of my questions, transportation. So it sounds like we're right there with the PACE mobile. Go ahead.
Exactly. The Hope mobiles, I like to call them, but they're traveling all around the community, providing transportation for the person to come to the Hope Center, the PACE Center, or to a doctor's appointment. So we have transportation and we have some meals too.
So y'all just make it all inclusive and the holistic approach to the process. That sounds really outstanding. This room that we're in now, we alluded to it earlier. I'd like to first of all thank you for the outstanding accommodations whenever Lead Pitch Live comes here. It's just a wonderful room. I was here last night and I just saw people sitting out by the water and all of that and just having, tell me where we are and what this means to the process.
We're at our Hope Care Center at Health Park, and thank you for those comments. There are times when people can't stay at home. And when they can't be at home, we want them to be in a very home-like environment. So our Hope Care Centers, we're sitting in the living room right now. We have a little kitchen area. We have a cafe. We have the water. It's very peaceful. We have walkways. And we want it to be very home-like. Private rooms for each patient. And the family can be with them 24/7. There are no official visiting hours. And
are you still sitting on some national boards and being an advisor in that capacity? I always like to brag on you because we have somebody here locally who has a global perspective and people seek your advice on various boards.
Well, thank you, Lee, for that. Yes, I still sit on 3 national boards where we explore how to really improve regulations, legislation, best practices for hospice, for PACE, for palliative care, and I've had the wonderful opportunity to actually give presentations around the world, in Austria, in England, in China. So it's been really
we're glad you come back and hang out with us sometime. You've been saying that hope is a safety net for the community. What does that mean?
Well, because we care for all people who are in need, people who don't have reimbursement for their care, people who need more than what the traditional healthcare community provides or a provider makes available to them. Because we care for the person, we care for the family, we keep them comfortable. We offer grief and bereavement services after the person has passed away. And we do that at no charge. And we are there when there is a need in the community, maybe after a crisis.
You're very passionate about diversity, about everybody taking advantages of the services here, regardless of race, creed, age, color, income status. How are you able to embrace all of that? And certainly as it comes to income status.
Well, we really depend on contributions and donations. There are many worthwhile organizations in the community. And at the same time, we are one of the few organizations that care for people with all different types of illnesses, heart, cancer, lung illness, ALS, and of all ages. We take care of babies. We take care, I think our oldest person on service was 104. So we're very inclusive of everyone. And what a pleasure it was to meet Beatrice earlier today. Because then we can be at the Haitian Family Fun Day for Health.
You got it down pat. The income. People sitting here and listening to us on the radio and watching us on television saying, well, I can't afford that. I think you guys have ways of working with people in that regard as well.
We do. And I want to say that Medicare offers wonderful coverage for hospice care. And also Medicaid, most private insurance companies, the VA, and if someone doesn't have any coverage, we'll still take care of them. And we'll also find some coverage for them because we're really good at that.
Wow. And the fact that you say you're really good at things, other people recognize that you're good at things. Recently, you received about 4 outstanding awards in different categories. I really would love for you to talk about that. Even though you're very modest about bragging, I'm asking you to talk about some of those great things that have happened.
Oh, that's very kind of you. Because it's an award that I may receive, but it's because of the wonderful work of our entire staff, the volunteers, and supportive people in the community like you. And I've been very fortunate to be recognized at the national level, at the local level, and in the very near future, I think there'll be more information out about those awards.
Okay, so the Palliative Care Organization recently received the 4 rings, the highest possible honor for quality connection, and so on and so forth. You are a nonprofit.
Yes.
One of my joys is whenever I go to your website and I donate to your organization, I know that it's going to a great cause. It's one of my favorite things to do. When I start making my donations in a certain time of the year, I go to your website. It's very user friendly, and people can support in different ways. Please expound.
Well, thank you for the donations and letting people know that we need those donations. We provide care that really is a safety net, and we can't do it without donations. So we want people to attend our events, to allow us to attend their events so that we can get information out about our organization, and also to donate to the organization. And I also appreciate you mentioning our quality achievement recently, because we were being recognized by the National Hospice and Palliative Care Organization for being the highest quality provider that is available for any community.
Is it fair to say that in Southwest Florida, you are the leader in the field?
We are. We are the leader in the field. We've been here for over 40 years. We provide care that no other organization provides at a higher level of quality than any other organization provides.
You mentioned the amount of time that you've been in the area. Having been in the area, knowing the terrain of the area, knowing the people, knowing the community, that's great as a thing that allows you to have all types of sensitivity to what's going on?
It really does, because of the fact that our staff, they're from the community. They live in the community. They represent hope at their church, at their community group, and we're been really integrated into the fabric of the community. And we live here and we care for the people here who are our friends, our family, our neighbors, our community members.
When I walk through the hall here, I see all these donors on the wall there. My name is not up there. I don't know what I need to do to get up there. I might not be that big time, but talk about what inspires people to donate to hospice.
Hopefully people are inspired by the quality of care that we provide. In fact, Beatrice had shared her own personal story, and people don't really know about us until they need us, or maybe a family or a friend has told them about their experience. And we believe that that's what inspires people to donate to us, to volunteer. We always need people to volunteer also at one of our care centers, at our Hope Chest, or maybe even sitting with a patient and giving the family member an opportunity to go out and have a break.
Is it fair to say too that you're in full operations now since Hurricane Ian?
Hurricane Ian was very difficult. At the same time, we have 2 of our hospice houses, actually 3, that are hurricane shelters. And we brought people in, yes. And so we brought people into the hurricane shelter care centers. And then we also made sure that the people who were at home had oxygen, medicine, and everything they needed during the storm. And then we got out there as fast as we could to take care of them after the storm.
When you mention that people don't think about it, but to have a professional organization like yours, in the moment, being able to know what's needed, to mobilize, that's all the more reason that, if possible, one should seek professional service in that time of life, right?
Absolutely. People who were calling because they're like, we don't know what to do. And so we want people to call early and have hospice care earlier, or one of our other programs.
Before I let you go, early on you mentioned the experts. You got people who live in the community who provide services, but you have world-class experts in all different areas who are providing these services, right?
Absolutely. Our staff are called upon to give presentations at the national level, at the state level, and we're accredited as an organization. We're surveyed by the state, we're licensed, we have quality recognition, and our staff are at the highest level of quality possible.
Well, Samira, it's been a pleasure talking to you again. Looking forward to talking to you in the future. And again, thank you for allowing WINK-CBS Live the pleasure of being here on your property.
Well, you're always welcome here, and it's always a pleasure to see you.
All right, shout out to Darlene and to Amy, who have also done an outstanding job in accommodating WINK-CBS Live here. Remember, Miami may have the oranges, but Hope Healthcare has got the
juice.
They got the juice. We'll be right back.
WINK-CBS Live is a WINK-CBS Enterprise production.
Hello everybody, this is Lee. I'm so glad that you watched that particular show, and if you enjoyed that show, we got other shows like that. Just subscribe to our YouTube channel, watch WINK-CBS Live on demand anytime, and also hit us up on all our social media platforms. Just type in WINK-CBS Live, and there you go.